Hey there, my name's Connor, and I'd like to welcome you to the White Coat Compass. We're really excited about this program as somewhere that we can have kind of a one-stop shop for you guys to kind of get all the information you need about pre-medical studies and how to get into med school and beyond. And so this is the first module of many, and it's called So You Want to Be a Doctor. So let's go ahead and get into that now. So what is a doctor? That's what we're going to get into first. People throw on terms like doctor, physician. There's also different degrees, MD and DO, right? So what does all that mean? We're also going to talk about the medical education timeline. So medical school, residency, fellowship. Do you have to do all three of these? How long do each of them last? What do they entail? We're also going to talk about compensation. What are doctors getting paid? We're also going to know how you know if being a doctor is right for you. And so there's a lot of different jobs in healthcare, right? How do you know out of all these 1,000 things you can do, even within healthcare, that being a physician is the right call for you? So first of all, what is a doctor? What's a physician? What are all these terms I'm using? So basically, anyone with a doctorate degree is addressed as doctor last name. So your college biology professor, for instance, right? They might have a PhD in biology, a doctorate level education. So you call them Dr. Smith, Dr. whoever, right? And so, but in the US, referring to somebody as a doctor versus calling them Dr. Smith is different. And so referring to someone as a doctor is going to strongly imply that they are a medical doctor. And so when you ask your professor what they do for a living, they're going to say they're a professor. They're not going to say they are a doctor. That's not their job. They have a doctorate level education. And so that's really the difference. And so when somebody is referred to as, oh, I'm a doctor, or they are a doctor, what do they do for a living? They're a doctor. That's going to mean that they're a medical doctor. And so if somebody if you just hear somebody referred to as doctor last name, then you don't know. They could have a doctorate in anything. But if somebody is talking about they are a doctor, or if they say a physician specifically, then you know that they're a medical doctor. And so being a physician, there's also different types of those, right? You've got DOs, you've got MDs. What's the difference there? So that's what we'll talk about next. So MD versus DO. They're just two different types of medical degrees, right? And so these are both going to be physicians. They are different but equal. And what do I mean by that? Well, they're equal in the fact that once you get these degrees, you have these same opportunities. So when you graduate from an MD school, you become a physician. When you graduate from DO school, you become a physician. You can apply to all the same residencies within all the same specialties. If a DO or an MD, they both want to be a pediatrician, they can do that. They both want to be a neurosurgeon, they can do that. They both want to be an emergency medicine physician or cardiologist. Any of these things, they have all the opportunities to do any of these things. And so how are they different? Well, DOs actually get something called OMT training, which is osteopathic manipulation therapy training, right? And so that's about another 200 hours or so of training, and that's something that MDs do not do. Other than that, they are pretty much identical in everything they have to learn and know. DOs can also take the same step exams that the MDs do for certification. And like I said, they can both become any kind of doctor. Another thing to consider is that there are far more MD schools in the U.S. than the DO schools. There's about 160 MD schools. There are 7 public DO schools and 36 private DO schools. And so I skipped this point to go down here because people think that DO schools are a lot easier to get into. And it's true that they have lower MCAT and GPA requirements, and not just requirements, but I guess the word I'm looking for is averages here, right? If you look at the average, the student's average, they tend to have lower MCAT and GPA for DO schools. So you may jump to the conclusion that they're just so much easier to get into, and that's really not the case. They're highly competitive to get into. There's also, as we can see, a lot less of them. And so by comparison, 160 versus 40 odd, DO schools, there's a lot more MD schools. And so that's also a factor to consider. And of the DO schools, only 7 are public. And so they're going to be also very competitive to get into. Another thing is that DOs tend to go into primary care. So when you look at the numbers of practicing physicians, what I mean by that is I mean that they are done with medical school, they're done with residency, and they're done with fellowships if they've done them. They're an attending physician. They're at their final stage. They're operating independently, right? They're in their own clinics. They're in the hospital, doing their thing. They're employed, and so about 50% of those people that are DOs are in primary care, whereas about 30% of MDs are in primary care. So there's a lot more DOs that are in primary care. That's not necessarily because they have to. Like I said, they have all the same opportunities. That's just how it is, and that's something to consider. And so again, they are equal. The vast majority of the general public would never know the difference, and really because there is none in clinical practice today. So the timeline. So college. Right? Usually about 4 years. If you did some dual enrollment or other accelerated programs, you might be done in 3. Great. If not, no worries. So gap years. I think gap years get a bad rap. In my experience, most of my classmates in medical school, they have done a gap year. And so people with gap years, they do a lot of things with it. They use it to their advantage. They work in a clinical setting. They do research, which is a really big one of helping you get into med school, right? They can do some traveling, spend time with family. They can either do a master's program. A lot of my classmates did that as well. And so at this point, most medical students have done a gap year in some capacity. It is no longer the norm to go straight from college to medical school, for better or for worse. But that seems to be the trend these days. It's trending towards that, and even from personal experience, I can tell you most of my colleagues have done that, and they've all benefited from it. So there should not be any bad stigma from a gap year. So medical school, that's going to be usually for about 4 years, okay? So the reason there's 3 in here is because some offer an accelerated program. You can do 3 years and you lock into a certain category of specialties. If there's some that you can go into primary care and do 3 years, and instead of doing your 4th year as electives, you go ahead and start your intern year. Residency. So this is after you graduate med school. You graduate medical school, you become a doctor, right? You become Dr. So-and-so, and you become a medical doctor. You're now a physician. You have an MD or a DO, and you apply to residencies, right? And so that is going to be the training that you have for your chosen specialty. And so you need this time to specialize, because in medical school you can't really cover everything, right? You cover a lot. You cover the foundational aspects of medicine. You learn a little bit about everything, but you really need to dive into one thing so you can really be able to take care of people in the capacity that you need to, and that's what residency is for. So it is paid training. It lasts anywhere from 3 to 7 years depending on your specialty. Things that last 3 years, examples are family medicine, pediatrics. Things that last 7 years, and there's only one that's exactly 7. I think that's neurosurgery, and that's the longest one. General surgery examples, 5 years. Emergency medicine, I believe, is about to become a 4-year program. And so there's different levels of years depending on what you want to do. And you can also, after that, if you'd like to, do a fellowship. This is not required, but say you want to be a cardiologist, for example. You go to medical school, then you do an internal medicine residency, and that's 3 years. And then you would go do a cardiology fellowship, right? And so that's how you become a cardiologist. That'd be a subspecialty. And you can even go further than that. If you want to be an interventional cardiologist, you can do another fellowship. So generally people only do 1 residency, but you can do, if you want to, multiple fellowships, or 0. You can go be an internal medicine doctor or a pediatrician or a general surgeon or anything like that, or OBGYN with no fellowships. It's not required. There's just those opportunities if you'd like to advance and become specialized within your specialty. It's called subspecialization. Let's see. So physician compensation. So there's something called the Doximity Physician Compensation Report that comes out every year. As we're recording now, it's 2025, and so that'd be the current one, but this comes out every single year. And it's important to note that not all physician careers offer the same compensation. What do I mean by that? Different specialties are going to have different averages. Not to say that all of one specialty makes more than all of one. There's overlap, but just the averages are going to be different. And so it fluctuates based on a lot of things, based on your specialty, based on the demand for that specialty in your location. And it's going to depend on how much you want to work. Some doctors, they want to work, 2-3 days a week in clinic. And so that's really tailored to your specific wants and needs and lifestyle and that sort of thing. There's also something to consider, which is going to be owning a practice versus being an employee. And so when you own a practice, generally you have the opportunity to make more money just because you're also a business owner. Versus being an employee, you're on a set, you get paid this amount for doing this, or it's hourly. Some even work hourly because emergency medicine physicians are a good example of this. They can do what's called shift work, right? And so there's all kinds of different ways, and so these are all things to consider. And so we'll take a look at some examples here. So this is from the Doximity report, and on the left we're going to have the 20 specialties with the highest average annual compensation. And so number one spot usually is neurosurgery, and they also have the longest residency. And another thing I'd like to say about residency, we talked about residency and fellowships, doing multiple fellowships, all these things. And you might say it takes a long time, and it does. It absolutely does. One of the things that we tell ourselves, I guess, to help us out with kind of swallowing that pill for how long we're going to be in school and in training, is that all these things that are listed on this screen, one of us really wants to be that. Some of us want to really be cardiologists. Some of us really want to be endocrinologists, child neurology, orthopedic surgery, all these different things. And so, they all have different levels of training lengths. And so basically the way we look at it is one day you're going to wake up and you're going to be 50 years old, right? You're going to get there eventually, no matter what you do, no matter if you be a doctor or not. But if you want to be a doctor and you want to be this, you want to be a pediatric nephrologist, you'd rather wake up at 50 and be what you want to be than not go all the way and not ever get there, right? So you're gonna the time's gonna pass. You might as well, if you want to be a pediatric pulmonologist, go be that, right? If it takes 2 fellowships, which I think it does. I think you would have to do internal medicine, then pulmonology, then pediatrics. So if you want to do that, go do it. It's a lot to tackle, but there it is. You also see these trends here with different pays, and so different compensation, and they're not all relative to how much time you spend in residency and training. Now, generally that is the case, but they're not all like that. Like I just said, pediatric pulmonology is one of the ones on the right here, the 20 specialties with the lowest average annual compensation. And so is that for lack of training? Absolutely not. You'll see a lot of pediatrics over here, and so there's many reasons for that. Children don't have many chronic illnesses, and they don't require a whole lot of procedures, and procedures generate revenue. And so, there's reasons for all these things, but generally everybody's doing very well. These are great compensations by anybody's standards across the board, even the lowest ones. And so, but this is just something as an example, and these are averages, and these fluctuate up and down, and some of these may make 3 times more than it says. Some individuals, it all depends on a lot of different factors like we talked about on the last slide. A lot of things, like I said, procedure heavy, so surgery, right? That procedure heavies are going to be generally make more money. And so let's see, how do you know if being a physician is right for you? So questions you can ask yourself is, do you gain a sense of happiness or enjoyment from helping others? Hopefully yes, right? It kind of makes you a good person, right? You like to help people. Do you enjoy learning science and putting it to work? I think that's important. You know, you can be the best person on earth, you know, and just the most altruistic human imaginable, Mother Teresa, right? But you have no interest in science. And that's something you need to consider. Are you able and willing to spend your days with sick people? Are you averse to the length of education or training? That's what we just talked about, right? So does being in school and or training for 15 years or so, does that change your mind about things? Or do you say, you know, like I said, I'm going to be 50 one day, might as well do exactly what I want to do. You know, you can do that or not. There's no right or wrong option there, but it's something that every person has to decide for themselves. Can you be in charge of making important decisions for your patients? You know, do you want that responsibility? Do you want that weight on your shoulders? You know, there's a lot of people involved in patient care, but ultimately it is the physician who's making these decisions. And it falls back on them not only in terms of legal liability, but in terms of your mental health. You know, I mean, you have to be able to make these decisions, and you have to be able to handle it, even when things go wrong. It's a big deal, and you got to ask yourself if you're up for that. The next big question is, what experiences have I had that have compelled me to go into medicine, and can those experiences be put into words? And a lot of people have trouble with this, really putting it into words. Why do I want to be a doctor? You know, what's the main reason? Where does it come from? So if you can't do that, it'd be time to explore, right? And so how do you do that? The answer is really shadowing. You need to get in there and spend time with different specialties and see what they do, the day in, day out, and you might love it, you might hate it, and that's okay. So that'd be my advice is to really get in there. And where do you start? You know, and we're going to have more modules on this, you know, and talk about this more in depth. But one of the people I always started with was, and who I always tell people to start with is their own physician, right? If you've got a family medicine doctor or whoever it is, your primary care provider, you ask them. You know, just, hey, I'd like to see what you do. I'm interested in this. And you know, most doctors I found are really agreeable to kind of showing you what they do, and because they enjoy doing it, hopefully, right? And so that's pretty much everything. Questions for consideration would be, you know, what made you want to be a doctor again? And do you have at least a basic understanding of medical education timeline? Hopefully better now. Are you interested in any particular field of medicine? That list I showed you of 40 or so specialties was not exhaustive. There's plenty more where that came from. Are you willing to confront the difficulties you'll inevitably face in your order to reach your goal? Like I said, it's going to be a long, arduous task to doing any of those things. Even if you're looking at doing, you know, general pediatrics and doing the shortest, that's one of the shortest, or family medicine, things like that, 3 years. That's still high school, college, residency. There's no easy way to become a doctor. Everybody, all these people are working super hard, and you know, that's a lofty goal. And so, are you willing to confront the difficulties in that? So that's everything for now. We will continue to get more in depth in the pre-medical process in the next modules, and we look forward to seeing you there.